Hi, my name is Rifa and I'm a student of Masters in Exercise and Health Science program at UHCL. The article that I'm reviewing today along with my classmates Aneri, Forum and Joe is the effect of therapeutic Whirlpool and hot packs on hand volume during rehabilitation after a distal radius fracture. It is a blinded randomized controlled trial, and this article can be found in the journal Hand, volume 12, published in 2017. The purpose of the study was to compare the immediate effects of hot pack and Whirlpool on hand volume in patients with distal radius fracture in the post-immobilization phase of their therapy. The secondary purpose was to check whether any volume differences between these modalities persisted 30 minutes after heat application and if any differences persisted after 3 more treatment sessions. The researchers hypothesized that due to the dependent position of the arm during heating, a Whirlpool would result in a higher increase in hand volume than the hot pack application. So for the study, participants were randomized into two groups using random number sequence. So 60 patients with clinically healed distal radius fractures were divided into two groups. Half received therapeutic Whirlpool and half received moist hot pack for 3 consecutive visits per week. After 3 visits, patients were discharged from the study. During each of these 3 visits, measurements of hand volume were recorded at the beginning of the visit, immediately after heat application, at the end of the 30-minute hand therapy session, and after completion of 3 weeks after enrollment. The method of measuring the volume had excellent reliability. For statistical methods, 2 change scores were calculated. The first change score was the difference in volume immediately after heat compared with the initial core measurement. The second change score was the overall volume change during the therapy session. 2 separate one-way analyses of variance ANOVAs were used to determine whether volume change was significantly different based on group assignment immediately after heat and then after a 30-minute time lapse. Assumptions for this analysis were that this was an independent random sample that was normally distributed with homogeneity of variances between groups, and the homogeneity of variances was confirmed using the Levin's test. The results showed that volume change among groups immediately after the heat application showed a significant difference, since the patient in the Whirlpool group had a bigger initial volume rise than those in the hot pack group. ETA square for this ANOVA was 0.22, suggesting that the group assignment was responsible for 22% of the variability in volume change in this time point. At this time point, the mean group difference in volume change with 95% confidence interval was 4.9 ml. The average volume increase immediately after heat for those in the hot pack group was 3.6 ml, whereas the average volume increase for those in the Whirlpool group was 8.5 ml. These increases reflect a 0.7% increase in volume for the hot pack group and 1.9% increase in the hand volume for the Whirlpool group based on the initial mean volume of hand for each group. This group difference in volume change was no longer significant when remeasured approximately 30 minutes after the hand treatment session. The ETA squared was lowered to 0.04. The 95% confidence interval for the mean group difference in volume changes at the end of the treatment session was 2.6 ml. The hot pack group had a volume change of 2.8 ml, whereas the Whirlpool group had a volume change of 5.4 ml. The total percentage change was 0.6% for the hot pack group and 1.2% for the Whirlpool group. The total volume change from study enrollment to study completion 3 weeks later was not statistically different across groups. The mean volume change difference between the groups with 95% confidence interval was 2 ml, The EDA squared for this analysis was less than 0.01, indicating that group assignment accounted for less than 1% of the variability in volume change throughout the duration of the research. So this study tells us that there was no significant differences in hand volume between patients in Whirlpool and hot pack groups at the end of the therapy sessions. There were also no differences in volume change between either group over a 3-week period. This study used a different method, elbow flexed and hand near the surface during heating, than the previous studies, which may have provided better results. While hot pack application requires lower cost and less maintenance in comparison to the Whirlpool therapy has the advantage of allowing more motion during heating and treatment. This means if the primary clinical goal is to reacquire range of motion in the carpal region, Whirlpool therapy may be superior in that it can both heat and allow for strengthening or mobilization exercises simultaneously. This study was the first to look into volumetric changes as well as those that take place throughout the heating process following a 30-minute therapeutic session. Other advantages of this trial include use of randomization by a therapist who was not engaged in assessment, blinding of assessors to group assignment, and a low rate of ineligible patients and participants who were lost to follow. Fortunately, parameters that may predict between group variations in edema were fairly equalized by randomization without the use of any stratification. Certain limitations existed in the study, such as lack of protocol standardization during post-heating. The authors indicated that stretches and active exercises techniques varied, as well as the length of the post-heating therapy time varied. So overall, amongst superficial heating modalities for distal radius fractures, Whirlpool therapy may be a worthy clinical choice to consider.